So looking at the landscape of artificial intelligence in healthcare, so in 2014, 2015, it was viewed as being a bit pie in the sky, crazy talk. And it's interesting to contrast it, what it was like years ago, to contrast it to now, where everyone's like, well, obviously we're going to be doing that. Like the way we're rearranging all of our operating lists now, we're using robotic process automations, and we're using machine vision things to help us catch up on backlogs of reporting. That's not necessarily in our hospital, that's in NHS. You can see these real applications of AI starting to come in now, whereas beforehand it was just a what if. Now it's actually happening.
I don't think AI is ever going, well, certainly in our lifetimes, it won't replace the work of doctors or nurses, but it will provide them, with new tools that can help change the way that they work. So, for example, autonomous telemedicine, okay, and that it is designed to alleviate the burden of doing lots and lots of routine kind of follow-up calls on post-operative patients. So rather than speak to a nurse over the phone, for example, how's your knee after surgery? Does it cause you pain? Can you climb the stairs? You're actually talking to a virtual assistant over the phone.
For me, there's one big thing is around safety, and how do you improve safety with the better use of data? And that's a really key thing for Alder as well, is that how can we improve our safety? How can we find that signal in the noise? Because we are generating more and more data every year, and that data, if it's analysed correctly, could have enormous benefits in spotting things before they're about to happen. So there was one application we put in where we were analysing people's pulse and blood pressure and respiratory rate to try and create an early warning system for whether or not someone was going to stop breathing, become really unwell, that our crash team would get called out to them. And by using that, I think it was by 50% they managed to reduce the number of crash calls by just analysing that data. So the potential to improve safety and improve the quality of the care by analysing data which we've already got, which we're already creating, that we just need to be able to just create the algorithms and analyse it, is absolutely enormous. And I wonder, when I look back in it, and hopefully in 20 years' time I look back at our current period and think, why didn't we do that? Why didn't we use that that bit of kit existed, that bit of artificial intelligence science existed, but we hadn't normalised it as a thing that you do in healthcare. I think that'll be really interesting to look back, but so much we could do.
I'm optimistic. I think the human race is constantly innovating. It's constantly trying to build new and better things. If you just go back 100 years' time, for example, where we are, where we were then. If we look to the future, to 100 years, I think technology is going to be really important to solve all of these kind of, the grand challenges that humans face. It's not going to be the silver magic bullet, but it's going to help.
I am very, very optimistic about what AI could do. I mean, I think it's like the antibiotics of our generation. I remember I was on a train once, and I had this really old lady in front of me. I mean, she looked about 100, and I was a junior doctor. I'd literally just started, I'd been a doctor for about a year, and she had this bag, and it had Sterling Medical Society written on it. So I got chatting to her, and she turned out she'd been one of the first female doctors to work at the hospital I'd worked at, Sterling Royal Infirmary. And I was having a chat to her about what it was like, and I said, what was the biggest thing? And she said antibiotics. She said she remembers when antibiotics got introduced, and she said we went around the hospital and we injected everyone with this stuff, and they all got better. It's just that we emptied the hospital. They thought they were out of a job, because at the time people were dying from wound infections and all sorts of syphilis and things which we never even heard of. What if we could develop drugs in a week that we did normally take in 10 years? We've already seen the benefits of developing these vaccines. That's been driven by data. We've done things in 1 year that would have taken 10. What if we could do it in 10 days? What if we never even had to do it? Our hospital has 279 kids in it that all have diseases which we should figure out the cure for. I mean, if I went back to Victorian Liverpool, where 50% of children would die before their 10th birthday, with a backpack of stuff from the hospital, I'd be like a living god. I'd just be walking around just curing children left, right and centre. There you go. antibiotics, nebulizer, insulin. I mean, the insulin story is a big one. I mean, when they developed insulin, they went round this ward of kids who were all in comas, injected them all insulin, and they all got up. I mean, it's just, it's magic. So that is what any sufficiently advanced form of technology is indistinguishable from magic.